What's up, everybody? Dr. Rossi, shrinksandSneakers.com. So, continuing along this journey of discussing various side effects from psychiatric medications, I want to move on to another one that's very common and not talked about as much as it probably should be, and that is the side effect of dry mouth. So, if anybody's ever had dry mouth before, if anybody's ever used these medications before and experienced some degree of dry mouth, you can know how irritating this can actually be. So I'm going to say a couple things about this to kind of preface the conversation and to start the conversation off. There's an increased incidence of both dental cavities as well as ulcers in the psychiatric population. Also, interestingly enough, psychiatric patients are 3 times more likely to lose all of their teeth than other populations. So you have to let that sink in for a moment. So this population is 3 times more likely to lose all their teeth. Really, really, really difficult situation. So you might be saying, Dr. Rossi, well, there's got to be something to this. Well, there's a couple things. I mean, part of that is, not following routine guidelines for, regular dental cleanings and regular dental procedures as needed. But there is also the fact that these medications sometimes have the risk of causing dry mouth. So let's find out what you can do about dry mouth and how you can treat that if you are indeed experiencing it. So dry mouth basics. What is the first thing that I might do if I have a patient who's experiencing dry mouth and maybe I'm a little bit worried about their dental hygiene in general and I'm concerned that they might be at risk for cavities and ulcers and other dental complications? First and foremost, you want to make sure your patient has a dentist. They have somebody that they can go to that's going to, provide them with regular cleanings at least every 6 months. In some cases, they might want to go as often as every 3 months, depending on the circumstances and, of course, how bad their teeth are. So establishing care with a dentist is probably the first and foremost, the most important thing. Then, after they've established care with a dentist, they want to make sure they're making those regularly scheduled visits for cleanings. So that would be my first intervention or recommendation for anybody who's dealing with dry mouth. So most patients dealing with dry mouth are going to be carrying around with them some type of bottle of water in there, and they're going to be taking regular sips of water. Now, that unfortunately does not get to the underlying cause of the dry mouth, and it doesn't really treat the underlying problem. So it would be far more preferable that they use ice chips or carry around a small cup with ice chips in it to help them with the dry mouth. However, this is inconvenient. It's not really practical. Most people are not going to be able to do this on a regular basis. So when you're thinking about this, what would be the next step? Okay. So the next step, the thing I like to recommend, is that patients look for a sugarless candy or sugarless gum and that they keep that with them and use it regularly. It can be easily carried in a purse or pocket. It doesn't really have too many limitations. And studies have demonstrated that xylitol, so when you're looking for the sugarless candy or gum, you're going to look for sugarless candy or gum that contains xylitol. So xylitol containing gum actually reduces the levels of streptococci in your mouth, the strep mutans in your mouth, and lactobacillus in saliva. That leads to and can even reduce plaque. So some of those things are the causes or potential causes of dental cavities. So first, starting with a sugarless gum or sugarless candy that contains xylitol would be a really good starting point. The next step would be, if that's still not working and you're still having some trouble, then there's several mouthwashes that help with dry mouth. One is called Biotene, and that can be had over the counter. It's not very expensive, and that would be my second line option. So establish dental care, start with sugarless gums and sugarless candies containing xylitol. Be using those regularly throughout the day. You can use ice chips in a cup if you're home or if it's convenient for you. And then if that doesn't work or you're still not working, combine those things with a mouthwash that also helps to facilitate saliva production and helps to prevent dry mouth. So that is Biotene or Biotene, which can be found at any drugstore around the country. The next step, if this really doesn't work, so again, I'm always thinking stepwise progression. what's the next step, and how can we do things that don't require adding another medication or another pharmaceutical intervention. But if it comes to all of these things and you're still not having success and you still have dry mouth and still causing problems, then there are medications to stimulate saliva production, specifically pilocarpine. So pilocarpine is an eye drop actually, which acts locally. So this is a good option. What you could do is you put these drops in some water and you swish the water around in your mouth and you spit it out. You don't swallow it, so you don't want to swallow these drops, but they are helpful because they will act locally in the mouth and enhance saliva production. So my approach, at least to any of these side effects, is start with the most basic thing. Establish dental care, make sure the person's going for regular cleanings, and make sure they're doing the right things as far as their dental hygiene and dental care is concerned. Then, if that still doesn't work, you can look at things like carrying around sugarless gum or sugarless candies, specifically those containing xylitol. If you find that that is still not working, you can step it up to adding a mouthwash that stimulates saliva production and helps to reduce dry mouth. And if that's still not working, the final step is the pharmaceutical route, and you're going to look at these pilocarpine drops, which you'll use in some water, swish around in your mouth, and discard. So that's my steps for treating dry mouth. If these videos are helpful to you or you're finding anything valuable here, please like and subscribe to the channel. And if you have comments or questions, drop them in the comment section below.